You asked for it, you got it. Which politicians in the national scene, in my opinion, have had obvious plastic surgery? This video is for you. So guys, raise your hand if you've had plastic surgery. I think we have some takers. So I'm going to start with the three biggest figures that people routinely talk about regarding their plastic surgery and facial enhancements. And then I have a couple surprise guests at the end. So let's get started. First up, we have Joseph Robinette Biden Jr., the current president of the United States. And he has clearly, at least in my opinion, had several procedures to enhance his appearance. First off, for those of you who remember him back in the vice presidential debates back in 2007, he was just able to wiggle his eyebrows a little bit. He had Botox across the central forehead and a little bit of wiggling in his tails of his brows. It was absolutely hilarious. But he's had a bunch of work done. He has had, in my opinion, a pretty nice job of upper lower blepharoplasty. His periorbital region is much better than it used to be. He's got some just amazing veneers. I mean, those are crazy, amazing veneers. But what I really want to talk about is his facelift. He has got some of the most obvious stigmata of facelift surgery. Stigmata, for those of you who are unfamiliar with the word, it means a telltale sign. And it actually harkens back to stigmata, meaning like the holes in the palms and soles after crucifixion. So telltale signs or kind of burdens that you bear. He's got stigmata of facelift surgery. So here are the most common ones. He has got a facelift scar. Instead of being nestled into the perfect place where the transition between ear and cheek should be, it's sitting really far forward, and it's this obvious white line right here, and it's just horrible. The skin was also under tension right here, and that skin tension has pulled the tragus, that's this cartilage structure, it's pulled the tragus forward, because the tragus should be sitting back here and covering that external auditory canal, the external auditory meatus. It should be covering that, but it's not. So you're seeing right into the side of his head here, and his tragus is rotated forward. Another little bit of word trivia for you guys. Tragus means he-goat or male goat, because male goats and their little pointy chin get little hairs growing, and as men get older, this little pointy little structure here gets little hairs growing on it, and it kind of reminded ancient anatomists of a billy goat's chin. So as you go down from the tragus here, you can see his incision is still drifted forward. It's way down here, and it's absolutely horrific in my opinion. This is a terrible facelift incision, and it really deserves revision. And more than anything, I think the original procedure, there was too much skin tension put on the facelift, and the skin can never hold tension. It drifted further forward, pulling the tragus with it. So let's take another look at a different view of his facelift incision scar. So one, again, wow, those are some veneers. Those are the veneers to end all veneers. But let's look at his facelift incision scar and a normal ear that he used to have versus the weird ear he currently has. So again, look at this normal ear, look at the tragus, and you'll see it's giving that external auditory canal cover. It's keeping it modest, if you will. And there's just normal contours around here. Here we go, the tragus rotated forward, external auditory canal showing, and that facelift scar is just ghastly and drifted away from where it's meant to be. You can have good facelift incisions. So this is one of my facelifts, and if you look, the tragus is not distorted. It's sitting posteriorly, giving modesty to that external auditory meatus the way it's meant to be. The incision scar is sitting in the sulcus. It's sitting up here in the hair where it's harder to see, and it's just kind of mimicking natural contours. It's not drifting into weird places because there's no tension on the skin. As a matter of fact, all scars heal a little bit white, and we have to contend with that. And the way we contend with it is we place them in areas where there are natural color transitions between ear and cheek, or we place them in areas where when they turn white, which they inevitably do, they just look like the natural reflections in these areas where the ear has sharp curves and therefore gets white reflections. So if you look at this again, all those reflections here are natural. This reflection right here is not a reflection. It's my facelift scar. There it is. It's the continuation of that right there. So there are ways to make facelift scars very well hidden. Even in men, we can hide them really well. This is one of my male facelift patients. You see his tragus is not rotated forward. He doesn't have a ghastly white line in front of his ear. I even do these on revision facelifts. This is a beautiful young woman who came to visit me from Tennessee, and she had had a previous facelift, which unfortunately did not capture what she needed captured. She got a much nicer job, and I redid her facelift and did a deep neck lift with it. However, look at her old facelift incision. Same kind of sloppy work. Straight down, right in front. At least they didn't ruin her tragus. But it's not a pretty incision. It's not a well-hidden incision. So by taking time to, instead of putting it right here, put the incision into these natural contours, preserving shapes, we can get her a facelift incision that looks much more normal, much more better hidden. Let's go up to victim number 2. Oh, sorry, contestant number 2. Nancy Pelosi has, in my opinion, the epitome of 1990s facelift surgery. So in the 90s, it was all about how tight can you make it, how much fat can you remove. And so she has crazy high brows. So what her brow should be is down here. She should have a brow down in this position. And instead, it's way up here. That's just absolutely criminal, in my opinion. She's also a naturally lean woman. So lifting that brow up and doing a subtractive upper blepharoplasty where fat is removed has beautifully evidenced the shape of her bony orbit. You can see the eye bone, if you will. It looks absolutely skeletal, and that is a problem. She's got what we like to call an A-frame deformity, because that shape kind of looks like the top of a capital A. So we would, in these days, we would never lift the brow to here, right? We would leave it down in this area, or maybe a little higher than that, and build this skin here. We'd build it down, all the way down to here, so that we hide all of this orbital sulcus and really make it look a lot prettier. So we'd take a different approach these days. Another thing she's had done here pretty clearly is a rhinoplasty. She has got a very common complication of rhinoplasty where there is a shadow line that runs right here, and we call that an inverted V or upside down V deformity. And what that is, it's where the nasal cartilage right here and nasal bone above it, where these two have come unglued or come separated. And so you're seeing the contour break between the cartilage below and the bone above, and we call that an inverted V deformity. And again, this is classic. We still see this on occasion. I see it in my patients once in a while. But in surgery done in the 80s and 90s, where we didn't take extra steps to try to prevent this, we saw it very commonly. So inverted V of rhinoplasty right here. And then she's got this waxy look from super heavy resurfacing. So, you know, these days I tell my patients I'm going to get you 70, 80% wrinkle improvement. I don't shoot for 90, 100% wrinkle improvement because the complication rate is higher. And this kind of shiny, waxy look, I think it's worse than having residual wrinkles. So 1990s plastic surgery. Another example she has of kind of older style plastic surgery, again, there's the A-frame skeletonization. But another example she has of 1990s style plastic surgery is she has no bags remaining in here, but she's got a bag way out here. And so this is really common when lower lids are done, even today, when they're done inexpertly, we see this, where the fat bag recurs out here in this temporal pocket. The temporal pocket means towards the temporal. We call them nasal, central, and temporal pockets of the lower lid. Why is that? The lower lid fat pads, there's 3 of them. Again, there's the central fat pad, which is right here in the center of the eyelid. There's the nasal fat pad, which is towards the nose. And then there's the temporal fat pad, which is out towards the temple. The temporal fat pad has 2 components to it. The superficial fat, and then the deep fat, also known as Putterman's fat, named after my friend and thought leader in oculoplastics, Alan Putterman. So Putterman's fat is hard to go after. And as a matter of fact, when you're just starting to need lower lid surgery, it often looks like it doesn't need to be treated. And so a rookie mistake is to treat these 2 fat pockets, which show up early in 30s and 40s. And then when the person ages another 5 or 10 years, the deep component of this one, Putterman's fat, rears its head. For you surgeons out there, it's because the orbital septum thins there last. So as the septum is thinning up front here, these show up. And then as the septum fails here years later, or if you've taken the superficial fat and Putterman's fat shows up, the temporal fat pad recurs. So what she has here is the most common complication of lower eyelid surgery down the road, recurrent temporal fat pocket. That can be avoided. The other thing she's got in the lower lid area is just general emptiness. So these days I would have done a really nice fat transfer out into this whole zone to help frame her eye and soften her transitions. And so she wouldn't have the skeletal look. She'd be much softer and much just more feminine. So she wouldn't look as harsh. Maybe she'd be more approachable. All right, this is the meat of this presentation. We have the Donald. Before we get into some of the more obvious things, I want to spend a second and talk about his teeth. He's got beautiful dental restorations. Whoever did his veneers or crowns or bridge work or whatever that is, I think it's veneers, did a beautiful job. I mean, I think that's just really tasteful, and I think that's pretty outstanding. But what we really want to talk about, everyone wants to talk about, is the hair. So obviously there's the fake tan makeup situation. I'm going to let the makeup artists and estheticians and beauty professionals talk about what's going on with his skin tone. But I, as a facial plastic surgeon with hair transplant training, want to talk to you a little bit about his hair. So there's something odd about Donald's hair. I think every child can tell you that that's not how normal hair grows. It's in an odd direction. The density is odd. This is not what modern day hair transplants look like. And to be fair, he has categorically denied he's ever had any hair surgery, even though in one of his court documents, a divorce proceeding with Ivana, she claims he's had a scalp reduction. I think he probably has had a scalp reduction and or a certain kind of scalp flap. So let's talk about that. His hair comes out at a funny angle and is left to grow super long into this unbelievable kind of magic carpet comb over, right? So why is that? Well, I believe he's had either a scalp reduction, which is where they cut out some of the bald scalp in the middle and pull really hard from the two sides to help shrink the bald area. Because when men bald, we retain the hair around the back, the kind of friar tuck fringe, that stays, and the central part goes bald. So most hair transplant surgery or hair restoration surgery revolves around borrowing from this genetically resilient hair and planting it up front here where it counts more. So these days we do it with individual hair families, individual follicular units, and it's much more natural looking. But there were some shortcuts that we tried to use in the 80s and 90s and early 2000s, again, cutting out bald scalp and stretching the rest. Or, this is a little more advanced, and I think this is what Donald had, a flap surgery. So a flap surgery is where we find a little blood vessel, in this case is the superficial temporal vessel, and follow it and take the hair, the scalp that is on top of that. We take it, and it used to be here, but it gets turned and laid in across the front. So we have this genetically resistant hair, genetically sturdy hair that's not going to bald, and it creates a frontal hairline. Then we can take another piece from the other side and do the exact same thing and have kind of a double row. Now what we have as a result of that is hair that is genetically resistant to balding, creating a brand new frontal hairline. What's the problem? Well, there's this huge bald gap left in the middle. So how do you solve that problem? You do the magic carpet comb over and take all that genetically resistant hair, let it grow super long, and comb it over the middle of your head. So that's what I think he's got going on. And I actually think this really interesting part, I think that is the donor site where that piece of scalp came from. I think it was right there and was pedicled and turned forward, and then there's his magic carpet turnover or comb over going just like that. So I believe that is a juri flap, J-U-R-I flap. The next thing he's had, there's that makeup again, or the spray tan, or I'm not sure what it is. The next thing he's got is actually, I think, very tasteful. He's got a nice upper blepharoplasty. So in a male of this age, with this degree of crowding and hooding and aging of the brow, it just doesn't happen that the upper lid crease is nice and crisp and pretty and stays perfectly parallel to the lid margin. That just doesn't happen. So I honestly believe that his upper lids at this age, the upper lid fold would look more like this and be sitting on his lashes out here towards the outside. But the fact that it isn't is pretty much conclusive evidence that he's had an upper blepharoplasty. And why can't I tell for exactly sure? Well, because upper blepharoplasty incisions heal super beautifully. That skin is amazing. They heal beautifully. And even in men, within several months, they are very hard to find. So this is probably, honestly, 10 years old, because over more time it becomes even harder to find. But I believe he's had an upper blepharoplasty, and that's why his upper lid margin is so crisp and perfect. So in my opinion, that is pretty much what Donald had. Hair surgery, either scalp reduction or jury flap, upper blepharoplasty, and a really nice job of dental restoration. And then again, the face makeup or tanning. So with that, we're going to come to the first of two mystery guests, Melania. Melania had in a distant past rhinoplasty, and she's had some breast augmentation surgery too. But what I really want to focus on is what has happened to her face between these two photos. And so just like Nancy Pelosi was an example of 1980s, 90s thinking gone wrong, where tighter is better and sculpting fat is better. In my opinion, Melania is an example of 2000s, 2010s thinking gone wrong, where fuller is better. And so what is really true is as the face ages, some areas gather fat pockets, like that temporal pocket, that need to be removed. Other areas waste and they need to be refilled. And then the whole surface becomes loose and we need to tighten the surface if we want it to look truly natural and pretty. If we try to take care of all those things just by building up volume again and again and again, every time there's a little bit of slack, accommodate that slack by making the face bigger, we get this look, this kind of pillow face, dough face, featureless, just a big snow mound kind of look. And I just don't think it's pretty. She is pretty, but I don't think the look is pretty. So instead of taking away the excess skin, instead of doing a brow lift, they just filled the heck out of that to take up all the slack. Instead of taking out the fat pads and doing some tasteful filler down here, they just filled the heck out of that. And that completely eliminates her eye. I mean, her eyes are a beautiful feature and you just don't see them anymore. The entire cheek is just, it's just huge. And a pretty woman, I hate to see that. Her head is 50% bigger than it's meant to be. The whole thing is just huge. So what happened? It's not like her injector said, I'm going to take this and I'm going to make that. They didn't intend to do that. And it's the same thing with Nancy. What happens is she comes in, she gets a series of injections, she looks better, she comes back in a year or so, she's aged a little bit, injection, she looks better. And you kind of get into the rhythm, into the habit of injecting anytime something looks older. And it's hard, even if her injector or her surgeon says to her, you know, it's starting to get to the point where you need to stop doing injections for a little while, start taking out the fat pockets, start tightening with facial surgery instead of filling every bit of slack. It can be hard for a patient to accept that. It can be hard for a patient to find 2 or 3 weeks out of their life to accomplish that. And so it kind of becomes, well, let's just do one more round of injection. We'll push that decision off. And it's kind of a boiling the frog situation. Little by little by little, you end up in a place you didn't mean to be. And so I honestly believe 5-10 years from now, we are going to look back at these pillow faces with the same horror that we look at Nancy's face now and say, what were we thinking? That is an absolutely unnatural look. And what was that provider, surgeon, injector? What were they doing? That's terrible. So again, I think that's not the best look, although she is a beautiful person. Final mystery guest, Kellyanne Conway, former counselor to the former president. This, in my opinion, looks like a little bit of heavy filter and makeup, but this is a nice job. This is, I think, how it should be done. I believe she's had a facelift. I believe she's had lower blepharoplasty. I believe she's had laser skin resurfacing. But what's tasteful about her is that where she was skeletal, the volume is built back out appropriately. Where she had loose textured skin, that skin has been ironed appropriately. Where she has excess motion, that motion has been softened appropriately. Where she was loose, she has been retightened appropriately. So I believe she's had actually a facelift, blepharoplasty, laser resurfacing, and injections and neurotoxins. And despite all of that, I think this is the most natural restoration out of all of these others. So these days, by picking the right procedures, by matching their strengths to the needs of your face, and by doing it kind of with good care and good balance, I think this is a good example of a really nice result. So I'd be interested to hear what you think of the analysis that I did of President Biden, President Trump, Melania, and Nancy Pelosi, and Kellyanne Conway. I'd be interested to think if you agree with my tastes and you think what was good was good, what was bad. I'd be interested to think if you think I'm totally wrong. So let me know what you think in the comments below. I would be happy to do another one of these if you have people in mind that you'd like me to analyze and give my opinion on. Thank you so much.